I want us to pause for a moment to reflect on what our sister Maria had to say. Because Maria represents all of the patients who get their care at Rallied Hospital right now. Maria is the essence of why we fight. What's love got to do with it? Everything. Philadelphia, we pause today to let you know that we are here because you are here. We are here because the struggle is here. We are here because the needs are here. We are here because the people are here. We stand in solidarity with you side by side, an ally in the fight to keep this hospital open.
We should not be talking about shutting down a major hospital and converting that property into hotels or condos or some other real estate opportunity.
This is Jen from Status Quo, and the Bernie Sanders rally in support of Hahnemann Hospital and Medicare for All has just ended, and I'm here with one of the nurses. What's your name?
My name is Jenna McAllis. I'm a registered nurse on 17 North. I've been here for about 2.5 years.
And you are part of the nurses union, correct? Can you tell me a little bit about the union, about what you guys are doing and organizing?
So we're basically rallying everyone together. That's from city representatives to state representatives. You saw that our presidential candidate went out here. Bernie Sanders was out here on the floor with us. Right now, we're focused on funding and trying to find a potential buyer for our hospital.
Absolutely, and a lot of people have been talking about Joel Friedman and his role in this, that he purchased Hahnemann and basically seemed to have the idea to run it into the ground because it's valuable real estate. What are there are a lot of visceral emotions around that. Do you think that's accurate? What do you think is going on here kind of behind the scenes?
I have been in meetings with Joel Friedman. So we have met with him regularly, along with the city, as well as insurance companies such as Blue Cross, also with Drexel and 1199C and also PASNAP. We have given him multiple opportunities to turn this hospital around, make it a nonprofit facility, and every single time he turned our resources down.
Wow, it's not shocking, but it should be. I mean, this is a hospital. You guys serve a majority poor, majority minority population. It's a safety net hospital. How would the closure of Hahnemann impact this community?
So yearly we see about 40 to 50,000 patients a year. As of right now, ER wait times at Temple, at Einstein, at Jefferson, at Pennsylvania are all above the national average. And that's without Hahnemann fully shutting its doors. You can only imagine what's going to happen when those seconds matter between life and death.
And as a healthcare professional, you see and you treat people as they come in without regard to, you don't look at their bank statement before they come in. You just give them the healthcare that they need. And it seems like people like, we might get run over here, let's move a little bit. People like Joel Friedman, he's not a healthcare professional. He doesn't see the needs of the people or seemingly care about the needs of the people. And Bernie Sanders here today was talking about Medicare for All. What are your thoughts on Medicare for All and how it could have impacted Hahnemann had it been in place?
If we had Medicare for all, it wouldn't be happening, period. That's just the end of the story. We wouldn't have people coming in from California trying to make a profit off of people's lives. So I fully support Bernie Sanders and his movement, and I'm really thankful to have him here today.
It was really interesting in his speech. He was going to introduce, I believe it was introducing legislation to offer some temporary funding for hospitals like this. I don't know that it would be in time for Hahnemann, but what are your thoughts on his introduction of that, at least?
I like the idea, but we need money and we need it fast in order to save this facility. I don't know what I would do without Hahnemann, to be honest with you. I love this hospital, I love the people, I love the patients. Unfortunately, this bill may be coming a little too late.
Yeah, it seems like that's what most people think. It's a valiant effort, but it's too late. What's to be done for Hahnemann right now? You're in all the meetings. Is there hope for right now for Hahnemann?
As long as these doors are open, we're going to keep fighting. and that's the end of the story. I took an oath when I graduated Community College of Philadelphia as my first day as a registered nurse. You know, we are the advocates at the end of the day. You know, I'm not going to let my Philadelphia people down.
What is the Philly DSA's involvement? Why are you guys here?
So we're out here. We've been following this issue since it came up a few weeks ago. But we're out here really to support the workers at Hahnemann and to keep their hospital and to make sure that one person's greedy private interests don't define healthcare for a huge number of Philadelphia residents.
And by one person, I assume you're talking about Joel Friedman, who purchased Hahnemann Hospital, I believe, in 2018. And a lot of people think it was just for the real estate, that he's kind of run the hospital into the ground. What are your thoughts on that?
Yeah, I mean, this is a safety net hospital, and hospitals like this don't make a lot of money. And Friedman came in and he wanted to scrap the whole thing, sell it for parts. This is a great real estate location, but it's also an important place for a hospital. You know, this is 56,000 ER visits a year in this hospital. That's working class Philadelphians. No other hospital around here can absorb that amount of patients. And this is over 2,000 union jobs right here. And Philadelphia is a poor city. We need to keep these jobs in this city. We need to keep this hospital open. Friedman has no interest in keeping the hospital open or in healthcare in general. What he has an interest in is selling this building, making a profit off of it, and turning it into more luxury condos.
Absolutely, and as you say, this is a safety net hospital. 2/3 of the people are of minorities, and the majority of people here are poor, low income. What are they going to do? How is this going to impact the area if this is turned into condos?
I think it's not clear. I mean, one thing that's clear is that people will have to go elsewhere to find healthcare. The people that work here are going to have to go elsewhere to find jobs, and I think you're going to see the same sort of patterns of city change and city development that we've seen in other places. If this becomes condos, this changes and shifts the whole demographics and the sort of makeup of the city. So.
Yeah, and this isn't the first time or the last time that this is going to happen. With a for-profit healthcare model, hospitals like this one are not alone, right? Lots of hospitals like this can undergo the exact same thing. So yes, maybe it's possible that the other hospitals could absorb the patients from Hahnemann. I doubt it, and I'm not sure they really even want to, especially if they're run on a for-profit model, because poor patients don't make hospitals money. So if we're going to continue with a for-profit healthcare model, Hahnemann's certainly not the first, and it's not going to be the last.
Yeah, you talk about a for-profit model. One of the things that Bernie's here today, I know DSA supports, is Medicare for all. If we were a nation that had Medicare for all, would Hahnemann be closing?
Absolutely not. Absolutely not.
You would see a model for healthcare, which is not what facilities are profitable, but what are serving their communities and giving people the healthcare access they need at a price that they can afford, which would be free.
Right. No, if we had a Medicare for all system with global budgeting and we actually had the federal government say we're going to fund these hospitals for need and not for profit, hospitals like Hahnemann would be open and they'd be better run and they'd actually be able to serve the working class people that go to them.
Joe Biden today came out with his plan to save the ACA and expand on it. What do you have to say to Joe Biden and his plan?
Look, the ACA the best parts of the ACA have been attacked by Republicans, and right now all Biden is trying to do is prop up what's left of a failing system. We've gone through every mechanism of how to reform our healthcare system. There's only one left that's actually going to fix it, and that's Medicare for all. Everybody knows it. Anybody who looks at any of the statistics can see clearly there's one system that can work. It works in 100+ other countries around the world. Why can't we have it in the richest country in the world? There's no way Biden's plan is going to actually fix the healthcare system.
And it doesn't change the underlying fact that unlike other Western industrialized democracies, the main motive of our healthcare system is to generate profit for a small few individuals. The Affordable Care Act didn't change that. I think it was a valiant effort. I should be fair, I haven't read Biden's proposal.
It has no surprises, I'll just say that.
Well, then then we won't be surprised by my continued stance in support of Bernie.
I mean, if you look at some of his own projections said they're going to lower the uninsurance rate from something like 9.8 to 8.5%. That's still 8.5% of people who go uninsured. That's how many deaths each year just from uninsurance. And that's supposed to be a fix when we can actually leap to 0% uninsured with Medicare for all. That seems like the only solution that we can even entertain at this point.
Great. Any last words you want to leave us with about Philly DSA and your mission, or just anything about today?
If you're interested in getting out and supporting the Bernie campaign, we'll be having our first canvas this coming Saturday in South Philadelphia. You can find details online, or you can meet us at noon in Dickinson Square Park. So I hope to see you there.
We're going to need to mobilize a ton of people to win this race, and in Philadelphia, we're going to need to knock over 200,000 doors. So if you're interested in Bernie, if you know Medicare for all is the solution, you have to come out and knock doors. You have to come canvass. We don't have the press, we don't have the money, but what we have is people, and we need to get people out on those doors.
So we're here protesting to keep Hanneman open due to the gentrification that has been happening in the city of Philadelphia. And so we're here to protest to keep it open and be a safety net for the people of the community of Philadelphia.
I'm gonna look at your sign, people over profit. We want Hanneman, protect the people. Oh, and I like Joel is a piece of turd down there. Do not make me find a new hospital when I have a good one already. So do you guys live in the area? How's Hanneman impacted your lives?
Well, I know that Hanneman, it hasn't specifically impacted my life, but I know that there's a lot of people who have low income that come to this hospital. So I feel as if this is taken away, then what's going to happen to them?
I used to go there when I was a kid, and it really helped me a lot. It was one of the only places that I had an ear infection, and it was one of the only places that could take the infection out, because other places said they couldn't do it. So it really did help me a lot.
Let's talk about your Joel is a turd comment. Obviously that's Joel, reference to Joel Friedman, who bought the hospital and is basically run it to the ground and is selling it. What do you think they're gonna do? Turn it into condos?
Yeah, I feel that if he wants to make profit, I feel like he's gonna turn it into some luxury condos, which is gonna cause problems in the area because it's most likely gonna raise the rent in other areas if they build luxury condos here. And I don't agree with it because it's just not fair. He needs to think about other people than himself.
What do you think about Bernie Sanders' speech right now? He talked about introducing funding to save hospitals like Hanneman. He talked about Medicare for all. What did you think about his speech?
I actually very much agree with it due to the fact that I believe that this hospital should stay, most definitely. And I also agree with Medicare for all because people need to have easier access to insurance, and there's a lot of private insurance now, and not a lot of people can afford it. So people need to be able to get medical help if they need it easily. And this hospital needs to stay also for the fact that a lot of people work here. So what happens to the employed when it's gone?
Hope you enjoyed that last video. Hop on over to statuscoup.com where you can sign up for our email list and become a member for as low as $5 to $10 a month. Membership is how we grow. That's statuscoup.com/join. And remember, join our email list so we can grow the revolution with you.
Stop.